Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow. Thank you for joining us here on the NPTE Final Frontier podcast. My name is David.
And my name is Emily. Today, we will be discussing the anatomy of the meniscus and how to test for meniscal injuries or, more specifically, meniscal tears. So first, it's important for us to review and understand the anatomy of the meniscus. The meniscus is a fibrocartilaginous structure within the knee joint, which is divided into a medial and lateral component. The meniscus plays many important roles, which include load transmission, shock absorption, joint lubrication and nutrition, joint stability, and proprioception. So now let's discuss the main difference between the medial and lateral menisci. So the medial portion has a crescent letter C shape. It's larger and thicker when compared to the lateral portion. It is wider posteriorly and becomes more narrow anteriorly. It has attachments to the medial collateral ligament, the knee joint capsule, and the anterior cruciate ligament, or the ACL. The lateral meniscus has an O shape. This occupies a larger portion of the tibial articular surface and is more mobile than the medial meniscus. So the meniscus is primarily an avascular structure with the primary blood supply limited to the periphery. Only the peripheral or outer 10 to 25% is vascularized. When the meniscus is damaged in the central portion, it is usually unable to heal naturally since this portion is avascular. Since the peripheral portion of the meniscus has a blood supply, like we mentioned, this portion is more likely to heal naturally. So now let's shift our focus to discussing meniscal tears or injuries, since we now have a better understanding of the overall anatomy. The medial meniscus is injured more frequently compared to the lateral. This is usually associated with the twisting force, especially when combined with rotation and compression. Injury can also occur due to cutting maneuvers or fast transitions when the individual attempts to turn, twist, or even change directions while weight bearing. These injuries can occur during sports such as basketball or football, while at work, or even when getting out of the car. So the signs and symptoms of a meniscal injury include swelling, which can cause limited end range flexion or extension, popping or clicking, a catching or locking sensation in the knee, quadricep muscle atrophy, pain along the knee joint line during forced hyperextension or maximal flexion, or springy end feel with passive extension. So during the acute phase of a meniscal tear or injury, the patient may be unable to bear weight on the involved side, specifically due to pain. So now I'm going to pass it over to David, who will discuss some common clinical special tests which are used to determine if an individual does have a meniscal injury.
All right, Final Frontier Warriors, it's time to talk about those special tests. One of the special tests to determine a meniscus injury would include the McMurray's test. The purpose of this is to identify meniscal injury. To perform this, the patient lies in the supine position with the knee in maximal flexion, so the heel is all the way up to the buttock. The physical therapist then medially rotates the tibia and extends the knee. This tests lateral meniscus injury. The test is positive if this action causes a snap or a click accompanied by pain. For the medial meniscus, the physical therapist externally rotates and extends the knee. The test is positive if this action also causes a snap or a click accompanied by pain. Another special test is the Apley's test. The purpose of this test is to differentiate between meniscal injury and ligamentous injury. To perform this, The patient lies in a prone position with the knee bent to a 90-degree flexion. The physical therapist places the patient's knee on the patient's thigh to stabilize it. The physical therapist then medially or laterally rotates the tibia combined with a distraction, while noting if there is any restrictions, excessive movement, or discomfort. Then the test is repeated with compression instead of distraction. A positive test for a ligamentous injury would be if rotation plus distraction causes pain or increased rotation relative to the normal side. A positive test for the meniscus injury would be if rotation plus compression causes pain or decreased rotation relative to the normal side. Next, let's discuss the Thestley test. The purpose of this test is to identify a meniscus injury. To perform this, the patient stands on one leg. The good leg is tested first, and then the injured leg after that, and the physical therapist provides their hands for support. The patient then flexes their knee in a 5-degree of flexion and then rotates the femur medially or laterally over the tibia. The test is repeated with a 20-degree knee flexion as well. The test is considered positive for meniscus injury or meniscal tears if the patient experiences pain in the medial or lateral joint line. The patient may also experience locking or catching. The last special test that we're going to discuss is bounce home test. The purpose of this is to identify meniscal injury. To perform this, the patient is in supine position, and the physical therapist cups the heel of the leg that is being tested. The patient's knee is in complete flexion and then allowed to passively extend. A test is considered positive for a meniscal tear if the knee cannot be fully extended or has a rubbery end feel. It has also been reported that if the knee is allowed to quickly extend in one movement or jerk and the patient experiences pain along the joint line during this test, this is also considered positive for a meniscal lesion. Now that you understand the meniscus, here's a quote from Earl Nightingale. We become what we think about most of the time, and that's the strangest secret. That's right, warriors. Keep that positive mindset. There's a ton of distractions out there. Stay positive, stay powerful, stay in control. You are powerful. You are strong. You are a final frontier warrior. You will pass.
Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok.
Till next time, have a great day and a powerful tomorrow.